Welcome to Boston Children's Answers. I'm your host, Dr. Jennifer Arnold. As a mom and a doctor, I'm passionate about helping kids stay healthy and happy. So join me as I chat with other Boston children's experts to find answers for you and your family. Hi everyone, and welcome back. Today we're going to talk about a service that not many people know about, but one that is critical and has a high impact on kids' health, child life. As we get started, let's hear from our parent, Caroline.
Hi, I'm Caroline. I just found out my daughter needs to have surgery for her scoliosis. I'm feeling a bit overwhelmed about it myself. So how do I explain it to her?
Oh, Caroline, really great question, because let's face it, as much as we may not want it to be scary, we all know that coming to the hospital can be a very scary experience for kids and their parents at any time and at any age. It can provoke a lot of anxiety and stress, but did you know that there are actually a group of people in the hospital that their entire focus is to help make that experience the best it can be? And so today we're going to talk about our child life specialists. And to help us learn more about child life as a specialty and their role in the hospital, we're going to have a nice conversation with Caitlin McGowan, the child life specialist here at Boston Children's Hospital. Hi, Caitlin. Thank you so much for joining us today.
Yeah, thank you for having me.
I thought maybe it would be interesting for our audience to learn first, what is a child life specialist?
So we wear many hats, but a child life specialist is a professional in a healthcare setting that is really there to help the child cope with a medical experience. So we're really looking at ways to make the hospital more comfortable and child-friendly, but also help children and families to feel like they are part of that healthcare experience so that they can have positive experiences.
So now that we know what child life is, what drew you to that field? How did you become a child life specialist?
I actually had my own healthcare experiences when I was a child. So I had met some child life specialists that really kind of inspired my career choice. So when I was 12, I had idiopathic osteonecrosis. The blood supply to the hip stopped, and the bone to the hip was deteriorating and kind of collapsing a little bit. So I had a lot of hospitalizations and surgeries and doctor's visits to try to find a way to help that bone. And so along the way, I met a lot of child life specialists that made my experiences more positive and really helped me find coping skills that worked for me. And so when I was looking into kind of careers and what I really wanted to do with my life, I thought, I really want to kind of give back and be there to help other kids.
That is amazing. Yeah. And, so near and dear to my heart, too, because that's why I went into healthcare and medicine, too, because I was a patient all my life. And it just makes me so happy to hear that child life specialty and specialists made such a difference for you. Yeah. And that inspired you to become a child life specialist, too.
Yeah, absolutely. It's so important.
It's so important. Yeah. Well, as we get started, one of the things that I wanted to share is that not only did I benefit from child life specialists as a patient, my kids have benefited with their experiences in the hospital. The skill set that child life specialists bring to the table, especially for kids who are in the hospital and families who are dealing with highly stressful, medically complex situations. You're an invaluable member of the healthcare team, so I'm excited to get to learn more about the field with you today.
Oh, that's so sweet. I'm happy to share about it.
Aw. I wanted to ask you a question about the history of child life specialty because we didn't have child life specialists early on.
Yep.
But we went to a playroom, and the playroom was the place that we got to get away from all of the medical stress. Doctors and nurses weren't allowed to examine you in the playroom.
Yep.
It was sort of like your safe space. And there was a woman that ran the playroom. And, I wonder, is that sort of was that sort of the idea of the early beginnings of what became child life as a specialty?
Yeah, absolutely. That idea of someone being in a playroom was kind of the foundation of child life work. 1950, 1960s usually is when that kind of idea of having...
Okay, I was not a patient in the 50s
no,
and 60s.
No.
Just in case anyone's wondering.
Of course,
good to know. It started so early on.
Yes, it started so early on, and kind of the idea of play and kind of allowing those children opportunities to be kids. What we know as child life today really kind of came to be around 1980s, 1990s, and but those really beginning times really came from that idea of playing.
And then the specialty was born.
The specialty was born, yeah.
That's amazing. Yeah, I mean, I think about, I was a patient in 1970s, 80s, so that makes sense. Like, but maybe it was still just more of the concept of a playroom, and then, you know, as I got older, it was really becoming its own specialty.
Absolutely.
So you mentioned, so it's obviously today, child life is a very critical and really kind of what I think of complex role in the hospital. So there's a lot of hats that child life specialists wear today in healthcare. And so I was wondering if you kind of go through a little bit of a deep dive into what those hats are.
Yeah, for sure. So, of course, like we just talked about, play is our foundation, right? So we are there for that normalization, to play, to let kids be kids. We're really there for preparation and education. So sometimes we like to refer to ourselves as hospital teachers for kids. We focus on child development and what can we do to kind of allow children to better understand what's happening around them. You know, whether that's preparing them for what a procedure will look like or coming to the hospital in general. We really focus on making sure they have an understanding and that they're part of their care. But we also focus on things too, like procedural support and kind of helping children find coping skills and things that are going to work for them during difficult times. So whether it's, you know, identifying what distraction techniques work or identifying, you know, ways that we can, as providers, interact with the child to make them feel more comfortable. We're really there to kind of, you know, help children and families identify ways that's going to make a hospital experience easier.
Wow. So educator, helping to explain, you know, treatment, diagnoses, what to expect in the hospital for patients and their families. But also you help them actively live during care to help with the coping skills that are so key. Yeah. And I imagine that you probably see a lot of patients that, you know, come to the hospital a lot and that can bring on an immense amount of anxiety and difficulty with coping with procedures and even painful things. So can you give me an example of what that looks like? Because I feel like, you know, I've seen my kids go through painful procedures, and when we've had child life there, it's made a world of difference as to what that experience is like for my child. So I was wondering if you could share for the audience, because I think that's so powerful.
That every child copes differently, right? So just because a plan in place for one child works doesn't mean it's going to work for another child, or even for that same child on a different day or a different procedure. So we really use our assessment skills to look at the patient and the family in that moment to try to find ways that we can make the hospital experience easier. Let's use blood draw for an example. We're going to talk about things like, you know, preparation. Do we know what to expect? Do you want to know what to expect? Or would you rather be distracted? You know, do you want us to include you in that care and give you a job? Or would you, you know, rather have mom or dad or another caretaker be part of that? And, you know, like I said, it could look different every single day, but we're constantly reevaluating and working with the child so that we can find something that's going to make them feel comfortable and also kind of achieve that goal of care.
Yeah, no, I was just thinking that it's not only helping the child and the family, I'm sure, deal with that situation, but also help the procedure to have better success.
Yes, right? Helping staff and helping, you know, that success of a procedure and kind of, you know, allowing children to get that care that they need as quickly as they can in a way that is comfortable for everybody. It's so important.
So a critical member of the team.
For sure, for sure.
Well, so I just want to kind of ask, what does the path look like to becoming a child life specialist? And like, are there credentials that you need to achieve?
Yeah, that's a great question. So we actually have a pretty extensive background in kind of career path to get to where we really need to be. So a lot of us do have a bachelor's degree to start. That's a minimum. And it can be in anything related to working with children. And then many of us do go to school for a master's degree in child life and family centered care. So that program itself is a few-year program. We do a lot of coursework that, you know, is specific to child development, hospitalization, family-centered care, bereavement, all of those things like that. And then we do a 600-hour clinical internship. So we then do sit for a certification exam. Wow. Yes, and so then once we are certified, you know, just like everybody else, we have to keep up our certification. And the thing about it too is it's a competitive field.
Is it really?
It really is, which is surprising to a lot of people, but it is competitive. I mean, if you think about, you know, across kind of healthcare, a lot of people don't know about child life unless they are kind of here and need one, right?
Yeah.
So it's really a growing field, but it also is really competitive to get into some of these programs in hospitals.
I imagine that as part of the care team too, you know, you have to have that clinical expertise combined with the sort of the developmental expertise and all of the different things that you mentioned. So is there specific clinical training that child life specialists
That's
through?
a great question. When I think about kind of our training and learning about, different illnesses, different diagnoses, different procedures, there's a lot that goes into learning about these things so that we can then teach the children back, right, in a way that they're going to understand. So we do pay close attention to procedures, language, different terms, things like that.
It sounds like, you have to have a lot of tools in your toolbox as a child life specialist. So you have to have an understanding of the medicine, an understanding of coping, and just the psychosocial elements that go into a child's needs, in a healthcare or hospital setting. And then you I feel like you have to have expertise in terms of not only educating but clinical care, but also helping to be I feel like curious, right? To figure out what works for each individual child. So what are those specific tools that child life specialists use in their work?
Yeah, there are a lot of them.
I bet.
But, we always say that our caregivers and our families are really our biggest tool. We oftentimes partner with families because we know that they know their children, right? And kind of gather some information from them about previous experiences or things that their children like or don't like. We kind of can use other things too, like preparation books or even sometimes real medical equipment or doctor play kits to kind of normalize that experience and kind of allow children that opportunity to kind of explore some of those things and become comfortable.
Oh, very cool.
Yeah. So they get to be the doctor for the day.
Exactly. Why not?
Yeah. We also use things too like, distraction techniques or different coping things too. Sometimes it's a lot for a child to kind of watch a procedure or really take it all in. And sometimes it's best if they don't even want to be part of it. I want to watch my TV show over here and feel comfortable.
Wow.
So it's a wide range. And sometimes it really, I know we talked about this really early on too, but sometimes it just comes down to play, right?
Yeah.
And using play to reach some of those goals from the healthcare team and using play to normalize things and work through some of those things that they're going through.
I just think of all those tools that you're trying to integrate in the moment as you're meeting each unique patient's individual needs. And until you really deep dive into all the different, skill sets and the tools that you're using, I don't realize how much is into everything that you're doing with the kid and to help make that environment better, that situation better.
Yeah, and we do everything we can to partner with patients and families and even staff too. So if there's a request, say someone's been here a really long time and they have a birthday coming up, or they've taken their first steps after a big surgery, like we're going to be there to celebrate and normalize that and really kind of allow that child to feel part of that care and kind of celebrate their successes too.
That's really great.
Yeah.
There's a lot of expertise going into each of those encounters. Tell me a little bit more about some of the specific, types of treatments or therapies that you often integrate when you're working with patients and families.
Under Child Life Services, we have a lot of team members that we're all working with together. So, of course, we have child life specialists, but we also have music therapists, artists in residence. We have a paw prints program here, which is for pet therapy. So we have, our trained dogs and their handlers.
Yes.
We have art programs. It just goes on and on with a list of talented individuals who really come together to provide a wide array of therapies and support to children and families while they're here.
That's really incredible. Yeah, it gives you so many options for an individual patient to see what types of, therapies are going to help that particular child. Maybe it's music. I remember when I was a kid growing up, I had a lot of surgeries, and by the time I was in my preteen teen years, let's just say I wasn't a very calm, easygoing patient going into surgery. And
neither was I. It's okay.
Okay. So you feel me. Yes. Yeah. And it was hard for them to put an IV in me because I was just so over the top anxious. And you know what? They tried music therapy. And for the first time, honestly, there might have been some medication involved too, but music therapy got me to the OR without any major, hiccups. And,
Absolutely.
So those sort of different ways that you create that multidisciplinary approach to an individual child's needs is so great.
And it's really great to watch it grow as well. Provide some programming for kids and allow them to participate. And we also kind of have a big tech team too that's working on making sure we are all up to date and kind of providing options for coping that way too. So it's been really exciting watching our teams grow.
That's really great. Well, and in this podcast and in all of healthcare, I like to talk about how important the multidisciplinary team is to patient care, right? Because it takes, healthcare is not an individual sport, it's a team sport, and everyone brings different levels of expertise and different, needs to the patient or to benefit our patient. Can you tell us a little bit about how, as a child life specialist, you integrate with the larger healthcare team for patients?
Yeah, so we are very well integrated. Some examples of people that we work with constantly, our doctors, our nurses, our psychologists, social workers, the list goes on and on and on. We're finding those things that work well for certain families and kids. Once we gather that information, we want to share it, right? We want to make this easy for everybody. So we share our coping plans, we share our, assessments and recommendations, and kind of collaborating all together and kind of using what all of us know as our own specialties and skills to kind of meet that goal and implement kind of that best care. We are always willing to work with everybody and kind of hear collaborative ways that we can provide care together.
That's great.
Yeah.
So that kind of leads me to the next question, which is sort of what curious about. Where do child life specialists tend to work? Like either in the hospital, ambulatory, all over? We
work here at Boston Children's in a variety of areas. So all of your inpatient units are going to find a child life specialist, if not one, two.
Awesome.
Yes. And then we also are in outpatient settings. You can find us in kind of some of these alternative settings as well, such as, the Hale Family Center for Families has a wonderful child life specialist. The Seacrest Studios has another great child life specialist. The Trust here at the hospital has a great child life specialist. So we're really well integrated kind of throughout the whole hospital experience.
I'd love to hear a little bit more about the Seacrest Studios, because even I, as a newbie to Boston Children's, want to learn more about that.
Yeah, Seacrest Studios, great spot if you haven't been there, definitely recommend. But it is our hospital's TV kind of radio hub spot. So they film live shows with special guests sometimes, and you can participate up from your inpatient rooms or even stop by the studio too if you want to be part of a program. It's a really great spot that incorporates, technology and just fun and TV and just kind of a fun outlet here in the hospital.
It's really incredible.
Yeah.
You have a multidisciplinary approach with various team members that are all geared towards helping kids during their healthcare experiences and some of the tools in the toolbox. Can you help describe some of the nuanced differences in terms of how you might approach a child of different ages or in different settings?
Yeah, absolutely. It always looks different every day. So sometimes we have time to plan, right, and kind of call families ahead of time and find out some things that are, helpful for the child's coping or things that the child really likes. But sometimes it's unexpected and we're here and we need care and, what can we do to kind of help you cope in this moment, right, now that we're here?
Yeah.
So that's important to identify, but it's also important to know that, children need different things at different stages of life, right? So for some of our younger patients, things like, light up toys and even like peekaboo, kind of things that can help them distract and play and kind of even comfort holds from parents can make a big difference, having that caregiver involved in care. But then when we get a little bit older, it could look very different, right? It could look something like providing therapeutic art activities or involving them in some more advanced, technology play or creating videos together.
Oh, wow.
It's a wide range of things that we're kind of, the services that we're providing and the ways that we're reaching children at different ages, stages, but also their interests too.
You really have a lot of different, sort of tactics that you can approach each child, which is amazing.
Yes.
So we talked a lot about the impact of child life as a specialty for our patients. I came to realize just how critical child life specialists are in helping the parents or siblings. Can you tell us a little bit more about the role that you play as a child life specialist for those individuals?
We work a lot with families and making sure that they're comfortable and that they understand what's happening too. Sometimes when you're under stress, it's hard to process information and really understand what some of these new medical terms can mean. So sometimes we're there to kind of help formulate some questions that you may have for your care team, things like that. We're also helping them plan and kind of help their children reach those milestones, right? Just because we're in the hospital doesn't mean we have to stop reaching those developmental milestones that we'd be working on at home too. So we can help parents understand development, understand, ways that we can kind of reach those milestones that we have for their children, and kind of collaborate with them that way. And then siblings too are so important, right? We don't want to forget about our siblings at home.
No.
They're part of that family unit, and they're also experiencing some of this, even if they're not directly here at the hospital. They might be at home having a lot of questions of, what does it mean that my younger brother is in the hospital? What is happening? Where are they? Who's taking care of them? So we can do a lot of sibling support around education and preparing them for changes in medical status or coming for visits to the hospital. We're really looking at the whole family unit and realizing that a child is not just the only one here. This does impact everybody, and what can we do to make this experience positive for everybody?
That's really great. And yeah, no, as a neonatologist, I've definitely experienced that support with our parents, just having, like, especially even in a code situation,
Yes.
Having you there, someone, a child life specialist there, they're able to talk to the family, help explain to them what's going on, while, myself, I may not be able to take that moment to explain everything because I'm focused on resuscitating their baby, but I know confidently that someone who is able to not only support them but also to be able to translate what's going on into understandable terms is really key in that moment. So thank you for all of Child Life Specialists for doing that.
For sure, and we're there to debrief it. Let's talk about it. You know what is still worrisome, or what went well, and kind of ways that we can kind of really focus and support.
Well, and I think that skill set also translates right into non-emergent situations, because I also think you had said to me earlier that one of the things you do is help even give parents and healthcare providers tools to be able to have difficult conversations with other family members or siblings at home. Like if one child has a really devastating diagnosis, you actually help parents prepare them how to have that conversation with the other family members. Is that correct?
Correct, absolutely. Because it can be really daunting if you receive a diagnosis or some news or something that is going to be really hard for your child or your family. It can feel overwhelming, but we're really here to say we got you. This is some language that we can use. These are some ways that we can do it. Maybe it's a preparation book that talks about it. Maybe we're giving you some key phrases and really taking into consideration what the family wants to be using for words, but also kind of providing our background and development in ways that we can support children.
That's so important because, I mean, again, I now as a parent too, when you think about having to explain something to your child, you want to be honest, but you don't want to overwhelm them or scare them or use terms that are scary. And so just figuring out how to communicate with them based on their age and the situation. And I think just having someone to help guide you through that is can make or break an experience for a family.
And we tell families a lot too, keep it simple, right? A good example, is like a stretcher, right? We know that a stretcher is like a bed on wheels, right? So if a kid hears stretcher, they may think, oh my gosh, they're gonna stretch her, like stretch me, stretch who, right? But if we really just keep it simple, like we're talking about a bed on wheels, let's go take a seat on the bed on wheels, right? So sometimes even just simplifying terms can really kind of ease anxieties and kind of make it easier for children to understand.
Oh, wow. That's so simple, but so important.
Yeah, something we don't always think about, right?
The words we use, sometimes we don't realize how they can be interpreted.
Exactly.
Wow, that's great.
Yeah, absolutely. Just like Caroline's question earlier, how do I break this news? How do I tell her that we need surgery? That's why we're here. That's why we're doing what we're doing. We want to make sure that, we have tools and resources for parents and caregivers to use to have those difficult conversations with their children.
Wow. I'm just going to say all the things. This makes me so happy as a clinical provider and as a parent, like that there's just so many options, and that, child life is really becoming integrated into all aspects of care for patients.
We're really lucky to have such a big team here at our hospital.
Yes. I hope that all children's hospitals can continue to grow, because this helps to, I would imagine, prevent trauma, and it helps to improve outcomes. I'm actually curious, is there any examples you can share of sort of patients who, because of Child Life being a part of that care team, they were able to have a better outcome than maybe otherwise?
Absolutely. It happens every day. I have this one example that I just absolutely love so much. There was a child who was coming in for surgery. It was, a she'd had a couple before, so she was familiar with the hospital, and unfortunately, was pretty upset about having to come back, and the mother was really worried about telling her that she was going to be staying overnight at the hospital and having this surgery. And, she reached out to our child life team and said, help, how do I say this? How do I support her? I really want to make this a positive thing for her. So our team really helped her create a coping plan that was best for her, right? So things to look forward to, things that we can use when we're feeling anxious, ways that we can make this experience more comfortable in a way that she felt kind of in control of as well, right? And she did wonderful. She, coped beautifully on the day of her procedure and had lots of great activities and kind of connections that she built on that inpatient unit. So, it's really, we're here to work with everybody, right? We're here to work with those patients and families and kind of do what we can to make that experience something that is positive and make the hospital feel safe.
Yeah. Well, you're not only helping that child in that moment, but you're also helping to alleviate a parent's worst fear too, right? That's key.
Absolutely. That family-centered approach for sure.
Yeah. Mm-hmm. So, I imagine given what you do and all the different, ways that you interact with patients and families, I imagine that you have to also have a lot of cultural sensitivity, situational awareness, and even maybe a really strong sense of, equity, inclusion, accessibility with all the different types of patients that you interact with. I was curious if you could talk a little bit about that.
Every child and family is going to be different, right? So their needs are going to be different. Cultures can vary. So we're really looking at ways to have accessibility to all of our materials, the way that we implement care. Everybody has their own needs and ways that they want to be represented and ways that they, want to reflect different parts of themselves. So we're constantly looking at ways, whether it be in the activities and toys that we provide to make sure they're diverse and kind of reflecting all different cultures and representation. We're also working to celebrate all holidays of any sort. We are here to celebrate anything and everything.
I love that.
We need to continue these cultures and traditions that patients and families may be celebrating at home, and just because you're here in the hospital does not mean we're not going to celebrate. We are going to go all out in making this something that is close to their hearts and close to their cultures and homes and all of the ways that we can make it feel as close to their normalcy as we can.
I love that. Love.
Absolutely. I love it too.
It's always fun when I get to relate my daily work life with whoever it is that I get to have a great conversation and learn about their specialty. And I think our two specialties have actually interacted quite a bit,
Yes, they have.
So I'm at, Immersive Design Systems, which is, essentially our simulation and healthcare program, and Child Life, you in particular, and we have done some great collaborations together. And I was wondering if you could talk to our audience a little bit about what types of things we've done together.
For sure. We love collaborating with IDS in our department. There has been a couple different things that we've done with you all. Let's start with kind of talking about some of our patient and family-facing programs. So we have a few preparation programs that prepare children and their families for either the surgical experience, and it's been wonderful. We've had families come into our simulation center, go through the whole surgical experience from start to finish, have all of their questions answered, get to meet with providers, and really prepare them kind of hands-on for that experience. So it has been a wonderful program that has had really great outcomes and feedback for preparing patients and families.
I had never been involved until I came here of, using simulation as a way to prepare patients and families for care in the hospital. And I just think that's such a fabulous collaboration. So
it's a wonderful partnership, and it is so beneficial for the patients and families. Our Child Life team works with the Simulation Center as well for kind of our own trainings and our own growth.
And then last but not least,
yes,
we do simulation training. And so I know Child Life has been intimately involved with helping with our training programs to help children with medical complexity for their parents to be ready to go home, using more developmentally appropriate, patient-family-centered approaches. And then on top of that, our VR team, has worked with you all, right?
We're very lucky to kind of live in a time where we're integrating some of this really advanced technology to create positive coping.
Yeah, no, and the data is already starting to come out that using sort of that VR experience actually does decrease reports, or what do you call it? I guess assessments of pain because of that VR distraction that they're experiencing. Well, speaking of research, I love to ask our experts about what type of research is going on or what type of research is on the horizon. Can you share with our audience a little bit what's going on in research from a child life perspective?
Yeah, there's some great stuff happening. If we look at our larger child life services team, our music therapists have done some really great research on their music therapy interventions and work with caregivers and caregiver stress levels and, patient satisfaction and patient coping. So, all different avenues. We're looking down all these different ways to kind of learn more about the work that we're doing and the ways that we can continue to improve it.
We're constantly learning and we're making patient care better.
Absolutely.
It's really great. Thank you for sharing all that.
Absolutely.
Caitlin, thank you so much. It's been a pleasure chatting with you today. I always have to ask my final question. Is there anything that we haven't talked about that you would love to share with our audience?
I know we've mentioned it a few times here, but that we're really part of that care team. The American Academy of Pediatrics actually reissued a statement back in 2021 about the importance of child life and how we are an integral part of that care team. And, we have that extensive training and the skill set and the knowledge to really make the hospital experience positive for children and families.
I think that's really important to share because, obviously that validates the critical need for a child life specialty in hospitals and in patient care. Thank you. Thank you for sharing all your expertise and your experience with us today.
Yeah, thank you so much for having me.
So now on to doctor's orders. This is the part of the show where we prescribe an action that parents can take today to help raise healthy kids. So Caitlin, what are your doctor's orders today?
Yeah, I would prescribe the idea that we're always here. Support your family, your children. We want to help advocate for you and your child.
I think that's awesome. All parents should know that they can request a child life specialist, and it's an important part of their care team.
Absolutely. We're always here to support.
Thanks for listening. I'd also like to thank our guest parent, Caroline, and our guest expert, Caitlin McGowan. Remember to subscribe to our show wherever you listen to podcasts to stay up to date on the latest episodes. Want to learn more? Visit our website at bostonchildrens.org. Thank you so much for listening in, and I hope you've enjoyed our conversation today, and I look forward to seeing you soon.